Dental law and ethics. Risk management. What is risk management? Activities that will prevent or reduce the possibility of legal action by the patient against the dentist. Why is risk management important? Happy patients don't sue their doctors. Usually patients sue because they are angry. The dental assistant has a role in preventing a malpractice suit against the dentist. Rules of risk management for the dental assistant. Number 1, when in doubt, say nothing. 2, refer the problem or conflict with the patient to the dentist. Number 3, avoid guarantees and unrealistic expectations. Number 4, don't comment on quality of care by the providers, yours or others. Number 5, establish a rapport with the patient. Number 6, accurate, complete, legible records. Number 7, keep skills up to date. Number 8, perform at your best. Number 9, be prepared to assist in an emergency. And number 10, don't start any collections process without the doctor's permission. Patient records are the single most important factor in the defense of most malpractice cases. All interactions with patients regarding treatment should be documented. Clinical or phone conversations, even consultations where no clinical work is done. Most single important factor is in the defense of most malpractice cases. Things to include in a patient's clinical record: medical dental history, exam findings and treatment plans, detailed record of treatment provided, x-rays, letters from or about the patient regarding treatment, copies of prescriptions, lab or medical, written consult or refusal of treatment forms, notations of broken appointments or failure to follow treatment advice from the patient. Do not include in the patient's record any financial records, insurance claims forms, or irrelevant materials, for example, postcards from the patient. Clinical record entries. Use the next available line. Don't skip lines. Always enter ASAP after the patient's visit. Always date the entry. Sign or initial the entry. Clear, concise, complete entries. Typed or in ink. Legible. No pencil, because it can be erased. Whoops, I wrote the wrong thing. No whiteouts. Make correction ASAP after realizing error. Use one single line through the incorrect material. Add your initials and the date, shows who and when. On the next available line, explain the reason for the change, initial and date. On the following line, enter correct data, initial and date. Who owns the patient records? The patient. Paid for the treatment. Information is about the patient. Patient has the right to inspect and obtain a copy of the dental records. Requests for copies must be written, and they require a reasonable fee to be paid. The doctor. Records are created by the dentist for his or her use. The patient paid for the doctor's professional skill and knowledge may not refuse to release information because the patient has not paid for treatment received. Safeguarding patient handouts. Only authorized people can remove, read, copy, or otherwise tamper any record. Don't leave open files on the desk or computer when you aren't using them. Lock cabinets, turn off computers at the end of the day. Refer third-party inquiries to the doctor. Original records, charts, and x-rays don't leave the building. Cleaning out those files. If a patient has died, moved, or transferred to another dentist, that's an inactive patient record. Never discard without the dentist's permission. State laws establish the legal time limit for saving inactive patient records. Statute of limitations equals the time limit within which a civil suit for an alleged wrong must be filed. What if an emergency occurs? Emergency preparedness must prove that the dentist and staff took all appropriate measures to aid the patient and to assure a positive outcome. Does not mean that the dentist must provide definitive medical care. Does mean the dentist must know what emergency steps to take until help arrives. Must keep patient informed. All staff in the dentist must have current CPR certification. Documented emergency preparedness plans. Staff reviews and practice emergency plans twice a year at least. Emergency medical kit available. Staff needs to know where it is and how to use it. Call 911 if serious medical emergencies arise. Documenting the emergency. Every action during an emergency should be documented. What happened? Signs and symptoms, vital signs. What did we do to handle it? Medical kit, 911. What happened afterwards? Patient recovered, went home. Patient recovered but sent to the doctor. Patient recovered was sent to the hospital. Or patient taken by ambulance. Write it down. The DA's role in an emergency is to assist the dentist. Do not inform the patient of the situation. This is the doctor's responsibility. Keep written notes for your own use if questioned later. These notes are not part of the clinical record. Welcome to our office. Practice information brochure. Welcome. Address and phone numbers, staff information, office hours, parking availability, directions, appointments, emergency care, and insurances accepted. DA and risk management. Doctor's representative. The patient's first contact. Kind words lead to a calm patient. If the patient doesn't feel welcomed by you, that anger can carry to the doctor. Use good manners. Address the doctor with respect. Doctor, not the first name. Introduce yourself. Address the patient with respect. Use titles. Environment counts. Neatness. Signs to the receptionist or the restroom or exits. Phone manners. Smile. Listen to the patient and relay the message to the doctor. Respect the patient's time. Let the patient know that you know he or she is waiting. Patients will wait 15 minutes or so before complaining. Seat the patient as soon as possible. Making financial arrangements. Money is a sensitive issue. Don't embarrass the patient. Talk in a private area. Use a business-like manner. Make clear financial arrangements. Variations in payment options. Pay at time of treatment. Patient has insurance which pays some of the cost. Collections on overdue accounts. Americans with Disability Acts of 1990. The federal law to protect people with physical or mental impairments from discrimination in employment or from receiving services in public or private establishments. Mental or physical impairment. It substantially limits one or more major life activities. Dental office compliance. Wheelchair ramps. Rearrange the furniture to permit unimpeded passage. Grab bars in the restroom. Doorways wide enough for wheelchairs to pass through. Hearing and vision aids. Lower telephones. And large print signage.